Hello, in this video clip I explain how you can strengthen reflection on care in a dialogue group. In a dialogue group, participants reflect on their experiences in healthcare, on their work or during an internship in practice. We organize a meeting where they leave the care setting. For the students it's a moment to return to school, and where they will be able to reflect on their actions and the effect of their actions in practice. As a participant, we ask you to prepare this moment in writing, describing a situation you are impressed by, because you are so positively surprised by it. An example to remember. Or a difficult situation, for example, where you were not so sure what to do or because you were shocked by the situation. It helps you to share the situation and you could use some support. The situation can be related to a care receiver, a family member, a colleague, another student, a clinical leader, a coach in care ethics, and so on. By sharing the situation, the participants try to get some insight into the situation. For example, what was at stake here? Why was it difficult? How can I think about this? How would you respond and why? We invite the participants to really see the other person in the situation, to listen to the patient, to know his concerns, to reflect on the care provided, on their own actions, and on the existing alternatives, and to check how the care receiver experienced it. Participants make themselves vulnerable by elaborating on a situation they struggled with. Participants may fear the judgment of the others or of the instructor. It's important that the instructor is not the person who evaluates the participant who brings his or her experience. And anything discussed stays within the group. It is not discussed further afterwards. This provides safety and motivates the participants to bring things honestly. Before the meeting, we ask the participants to analyze the situation by reflecting on their own actions and thoughts, by asking some questions and to write down their answers. For example, what were you thinking? What did you want? What did the other person say? What do you think the other person wanted? Why do you think this? Did you do the right thing? We also ask to analyze the situation in steps, to understand better what makes a situation so positive or difficult. For the positive experience, we ask, what different elements do you see? What was so surprising? In the preparation, what elements contributed to this? What was your input? Did everyone think it was positive? In the difficult situation, we want to know, what growth points do you see? Which concerns do you see? Where do you need support? What is not clear to you? And for both situations, we want to know, what alternatives do you see? What can change in the positive or the difficult situation? What would you have liked differently? What goal do you want to achieve? So, how does the dialogue group proceed? At the start, the participants describe their situation, but they are not allowed to specify how they acted or how the situation ended. Not disclosing the end of the situation allows all participants to think openly on how they would think about the situation or how they would react without the influence of the person bringing the situation up. Subsequently, in group, the participants choose one of the situations they want to explore further in the session. The person who brought up the situation can provide then clarifying information. With this extra information, each person thinks about how he/she would react on the situation and writes it down. They also think about alternatives. The participants share their insights with each other, listen to each other and give advice. At the end, the person who brought up the situation tells how he or she reacted and how the situation ended or proceeded. Then alternatives are explored, how they can deal with this situation in the future. At the end, we look back. What did you learn? Do experiences make you look differently at care, at the receiver, at yourself as caregiver, at the department, at the organization? What do you know, what you did not know yet? What do you take with you to your work or your internship? Has this experience changed you? At the end, we ask participants to write a letter to a friend or to a colleague to tell what they learned and to explain why they also should go through this experiential learning method. They also share the letter with the teacher. Now we've come to the end of the video. Thank you all for watching and wishing you good luck with the tryout. This tool and video clip were created by Vives, one of the Belgian partners of the ETHCOM project.